Morning, everybody. So this presentation is actually on behalf of the Survivorship and Psychosocial Committee, and also a big thanks to our partners at POGO, and you'll see why, as they've been obviously integral in this study. So I'm going to talk about the Passport for Care. The goal of this project, and I'll explain in a little while exactly what Passport for Care is to enhance our long-term health outcomes in cancer survivors by implementing PFC in Ontario. So the Passport for Care is a secure electronic platform that delivers personalized evidence-informed survivorship care plans to survivors that they can share with their healthcare providers, and really is their tool for ensuring that they get the lifelong evidence-informed care and surveillance that they need. Essentially, we decided to roll this out in Ontario, but the ultimate goal is to roll this out across the country. And so POGO is working to create the technological links with the folks in Texas that can then be implemented across Canada. And so hopefully in the next iteration of ACCESS, we'll be able to take this nation. So what are the objectives? Well, we want to modernize survivorship care. There is real heterogeneity across the country in how we provide survivors with treatment summaries and care plans. Ontario has used a paper-based system for several decades now. And you can imagine that giving survivors at age 18 a binder with their treatment summary and care plans is hardly a good way to make sure that they start doing surveillance 10 to 20 years later when they need to start doing so. So we've been thinking about electronic options for a long time. And we particularly wanted to align with the Children's Oncology Group guidelines, which are the survivor guidelines that are used by most centers in North America and a lot of centers across the world. And pretty much everyone in Canada uses versions of these guidelines. But one of the challenges, I think, in the past with these paper-based guidelines, beyond the do we lose them, is when the guidelines change, there's never been a mechanism for informing survivors that things have changed, and things change all the time. There's groups of survivors that are designated high risk that new evidence suggests or not, and there's new risks that we find all the time. And I think as we enter this new era of targeted therapies and precision medicine, somehow we're going to need to be able to tell survivors what their long-term risks are. So in order to improve equity, continuity, and consistency of care across the country, we want to bring the Passport for Care to Canada. So Passport for Care is a secure clinical decision support platform developed at Texas Children's Hospital at Baylor, but they've really been designated as the official partner of the Children's Oncology Group in terms of guideline dissemination. For those of you who know the COG guidelines, it's a compendium about this thick that takes every patient exposure and then translates it into the things you need to do for life to maintain health. They've always been impossible to use, and this has been an opportunity to create something that's really easily accessible. And for anyone who actually wants to see how the Passport for Care works, you can go to their website, which is at the bottom, cancersurvivor.passportforcare.org, and get a better sense of how this works. But currently, there's about 165 programs in the US that enroll their survivors onto Passport for Care. And there are two provinces in Canada that have been using the system, Manitoba and Nova Scotia. The challenge for all of these centers has been that the way the data is entered is manually, which means either a nurse or physician or the survivor or their family has to take the entirety of their exposures, put it into the system, and then the algorithms will put an output that says, okay, these are your risks, this is what you need to do. The opportunity here is we could use the critical mass of Ontario and all our survivors to go to the Passport for Care group and say, can we create an electronic conduit that essentially lets us download from what is now CIP-C, which is what the majority of the programs across the country are using to capture patient data and treatment exposures, into Passport for Care and to generate these survivor guidelines. And because we brought this critical mass to them, they have been open to working with us. And I think that's the opportunity and innovation here, to make this a truly seamless electronic transfer of data. And the opportunity here is not just for current survivors to be able to get their treatment summaries, but at least in Ontario, we have data going back to the mid-'80s. And so for every single person in Ontario has a history of cancer, POGO has their treatment data, and so the opportunity to create a Passport for Care, essentially. We will need to be mindful of how to do this across the rest of the country, but this is the first opportunity. So we've been partnering with ACCESS, Baylor, and obviously POGO. And the strategy has been to enable the porting of CCC data from our provincial cancer registry into Passport for Care. POGO is matched the funding that we were very fortunate to get from ACCESS. They hired a project manager in 2025. The key piece, as you can imagine, was the concerns around privacy. This data is actually stored on a server in the US, but we've worked closely with our privacy and colleagues and legal colleagues, and this is kosher. This can be done. The data is all encrypted, and so there's actually no barriers to keeping this data there because of the data structure. And so POGO has really spent the last little while working on the privacy, legal, and technical issues. Because the patients are still ultimately associated with the treating hospital, this will involve agreements with each of the hospitals. In Ontario, that's 5, but across the country, that's 16. And POGO is actually hoping to have a pilot rollout in the new fiscal year, and then expansion across the province, and then hopefully in a future iteration, expansion across the country and translation into French. So these are the things we would like to do in the future. Ultimately, this is going to give us secure electronic access to personalized treatment summaries owned by the survivors on an app on their phone that they can share with any new healthcare provider. So if you show up in an emergency room or to the family doc or to the, the university campus health center, you can basically say, here's my treatment, here are my risks, here's the things I need. These will update in real time if the guidelines change and notify the survivors. Because of the move to make this electronic, we are hoping that this will not require too much work on the healthcare provider side. And ultimately, as I said, we want to implement this Canada-wide in a future iteration. So this is going to empower survivors. We hope, and we've got evidence to suggest that early identification of late effects can really change long-term outcome. And obviously, putting this tool in survivors' hands will make a difference. Hopefully, this will create consistency and continuity of care across providers and regions, reduce inequities, and ultimately be scaled. And to quote one of the directors of one of the aftercare clinics, Passport for Care provides survivors, regardless of where they live or receive care, with a single invaluable tool to understand their treatment, long-term risks, and recommended follow-up, essentially empowering them to optimize their long-term health and quality of life. I'm happy to answer any questions.
Hi, it's really exciting. I am kind of curious about the housing of the servers in the US, and if you could explain that a little bit more as a parent, and knowing that your kid's information, although he's an adult now, could be housed there, and how the legal aspects circumvent things like the Patriot Act, where your data could still be accessed by the American government, especially in the context of today.
Yeah, and I mean, I think that is a legitimate concern. And the truth is, years ago, we had actually looked into doing this, and those fears had been what had stopped us. The data is heavily encrypted on the clouds. I think they use Amazon cloud service. I suppose in theory, the Patriot Act could allow the US government to go after that information. But in practice, I think that's highly unlikely. This meets all the requirements of PHIPAA or in Ontario, so it's entirely compliant for the privacy rules. And at the end of the day, the patient will control their own data, so it cannot be used or shared with or accessed by anyone other than the patient without their express permission. So I suppose there may be theoretical risks, but I think practically, certainly the security is as good as anything you put on the cloud. And the legal team that advises POGO did not have any specific concerns around the Patriot Act or anything else. Importantly, each patient will decide for themselves. So there will not be some mass uploading of everyone's patient data. Each patient will be contacted, given the opportunity to enroll in the program. And if they so choose, their data will be ported. And if they don't, that's absolutely fine as well. So patients ultimately will have as much control as possible over their data.
Thank you.
Well, are the guidelines from the passport going to then feed back down to the clinicians who are running the aftercare clinics?
So the aftercare clinics will have access to the guidelines. Primary care docs will need to have the information shared with them by the patient. So this was originally actually designed as a tool to be used in the clinics to guide care. They then built the patient portal, but outside of formal aftercare clinics, the patient really controls who they share it